Malignant neoplasms of head and neck. The first one is laryngeal cancer. It's a cancer of the larynx, is a tumor most often of epithelial origin, affecting the upper respiratory tract. And the men are sick more often than a woman, and increase in the incidence occur mainly due to the male population. Risk factors for a laryngeal malignancy. The first one is untreated inflammatory and precancerous diseases of the larynx, such as papillomas, papillomatosis, dyskeratosis, or leukoplakia. The next is age and gender, persons over 55 years of the male gender, bad habits, and a genetic predisposition. Patients always complain on a cough, hoarseness of voice, sore throat, difficult breathing, choking when eating liquid food, and increase in the cervical or subclavicular lymph nodes. And from the anamnesis, the earliest symptoms of the disease are presence of the hoarseness of voice, coughing occur even at the first stage. But at the initial treatment of the patient, hoarseness of the voice is observed on the average for 6 months. And the choking when taking food, liquid food or water, the appearance of the enlarged nodes of the neck join it. On the physical examination, we can see increased lymph nodes from both sides. And on indirect laryngoscopy, we can see tumor formation from the one side or from the both sides. Narrowing of the glottis. And the instrumental research includes ultrasound investigation, CT or MRI, and always biopsy from the laryngeal tumor. And the differential diagnosis should be provided with larynx papillomas, leukoplakias, contact fibromas, or larynx fibromas. The next one is salivary gland cancer. It's a malignant tumor that affects the tissue of the salivary glands located at the parotid, submandibular, and sublingual and oral cavity. Etiological factors are not unclear. People are ill of all ages, regardless of gender. And the patient always complains for the presence of a single or limitedly displaced tumor, an increase in cervical lymph nodes, lesions of the facial nerve, partial or complete paresis, pain syndrome, and there may be rapid tumor growth. And instrumental research always includes ultrasound investigation of the salivary glands and the lymph nodes, CT and MRI, and the fine needle aspiration biopsy. And the cytological examination, here we can see the presence of the conclusions is sufficient for the making of final diagnosis, and histological examination. Differential diagnosis should be provided with polymorph adenomas, cysts, and adenolymphomas. The next is throat cancer. It includes nasopharyngeal cancer, oropharynx cancer, and laryngeal cancer. Patients complain on the presence of a tumor, the neck, a sore throat, nose bleeding, impaired speech, or pain syndrome, laborious breathing, discomfort for the throat, feeling of the foreign body. Risk factors for the throat malignancy is the presence of the untreated inflammatory and precancerous diseases of the pharynx, bad habits, genetic predisposition, and carriage of the human papillomavirus of the 16 type. In addition to biopsy to verify the diagnosis, it's necessary to provide X-ray of the head and chest, computed tomography, or MRI ultrasound investigation. These research methods provide more information about the stage of organs and tissues. This method allows to detect an increase in the lymph nodes. And the last one is thyroid cancer. Thyroid cancer is a malignant tumor that develops from a thyroid tissue. Cancer developing in the thyroid gland is divided into highly differentiated, its papillary and follicular type, and anaplastic, originating from the epithelium of the follicles, C cells, medullary cancer originating from the parafollicular cells. Patient complained on the enlargement of the gland, the appearance of a tumor on the front and side of the neck, voice changes, rapid tumor growth, shortness of breath, feeling of a lack of air when tumor grows into the return nerve and the upper respiratory tract. From anamnesis, it should be known that thyroid diseases, hypothyroidism, euthyroidism, and long-term use of the antithyroid drugs, ionizing radiation, or maybe the presence of the history of receiving radiation therapy. On physical examination, we see on examination neck deformity, then we should provide palpation of the thyroid gland and palpation of the regional lymph nodes. And laboratory researches include cytological examination and histological examination. And instrumental methods includes ultrasound of the thyroid gland to determine the structure of the glands and the tumor and the presence of the nodular formation. Ultrasound of the cervical and the subclavian lymph node, CT or MRI of the soft tissues of neck and the mediastinum, and fine needle aspiration biopsy from a tumor. And the differential diagnosis should be provided with nodular goiter, diffuse toxic goiter, and autoimmune thyroiditis.